Those stubborn smile lines and sagging skin around your mouth can make you look older than you feel, but they're not permanent. In this video, you'll discover proven natural methods to smooth, tighten, and restore firmness. Stay till the end. The last technique gives visible results in days. First, let's clear up what we're even talking about when we say smile lines. In the dermatology world, we often call them nasolabial folds or marionette lines. But simply put, they're those creases that extend from the bottom of your nose all the way down to the corners of your mouth. I really wanted to address this topic because it's one of the most common concerns I hear during cosmetic consultations, even from patients in their 30s and 40s. These lines are often among the first signs of aging that people start to feel less happy about with their face. At that early stage, they might not be particularly deep, but they're usually the first thing that makes someone think, "Oh, I don't love these changes happening to my face." Before we jump into how we can actually treat and improve them, it's truly important to understand what causes them, because without understanding the root cause, finding a real solution becomes incredibly difficult. These lines have a variety of causes. Many people call them smile lines because naturally, when you smile, you create a crease. Over your lifetime, repeated smiling eventually etches these lines into your skin. As time goes on, these lines can deepen and advance into more noticeable folds due to several factors. Beyond just the constant muscle movement from smiling, gravity also plays a significant role, pulling down your facial tissues over time. Unfortunately, as we age, our skin loses its elasticity and becomes looser, which means as it starts to sag, those lines become much more emphasized. The descent of facial tissues and the overall change in someone's facial shape are truly hallmarks of getting older. When you observe people who appear youthful or whom you can easily identify as looking young, they often have more volume in the upper half of their face. However, as the years pass, those tissues begin to fall, and we tend to accumulate more fullness in the lower part of our face, leading to noticeable jowling along the jawline and the deepening of those nasolabial folds. In addition to this general shift in volume, we also experience a more specific volume loss in certain areas. This is something I observe more often in women than men. As women age, we lose bone density, which means we actually lose bone volume in our skull, particularly in our face. When the maxillary bone, which is the bone that extends under your eye and forms your cheekbone, starts to shrink, it also loses support at the base of the nose. This can cause your nose to appear to fall back into your face, which further emphasizes those smile lines. Facial volume shifts are also evident if you lose weight. You'll often notice your smile lines becoming more pronounced. This is because the fat in your face acts as a natural support structure, and when that fat is lost, lines become more emphasized. I'm seeing this more and more these days, especially with patients who are losing significant weight in what many refer to as the Ozempic era. A common complaint from these patients is how much older their face looks, and specifically how much more prominent their smile lines have become. Of course, beyond the volume component, there's also a strong genetic factor. How your face ages is heavily influenced by your genetics, meaning some people are simply more prone to developing prominent smile lines than others. And as a dermatologist, I would be completely remiss not to mention how the overall quality of your skin contributes to these lines. As skin ages, it tends to thin out and become more dehydrated, making it more susceptible to developing and holding on to these creases. Things that can significantly speed up or emphasize this process include prolonged UV radiation exposure from the sun and, of course, smoking. There's another important, though often overlooked, cause of smile lines that usually makes so much sense to patients once I point it out: side sleeping. When you sleep on your side, you naturally press and smash your face into a pillow. If you already have a tendency for a crease to form along your nasolabial fold, sleeping like this essentially folds your skin in on itself, emphasizing that line for many hours each night. When you think about it, depending on how much sleep you get, that's 6 or more hours of essentially etching that line deeper every single night. So now that we understand the various causes of these lines, what can we actually do to improve them? Let's start by discussing the things you can do right at home. These at-home interventions are primarily designed to help improve your skin quality, making it less prone to creasing rather than directly fixing already deep smile lines. I truly don't think I do a video without singing the praises of sun protection and topical retinoids, but they are genuinely the holy grail for keeping your skin as supple and youthful as possible. The more collagen you have in your skin, especially around the cheek and upper lip junction, the less prone it will be to creasing and folding over time. In terms of at-home devices, there are a couple of options to consider. An at-home red light LED mask can be very beneficial. And while you can also get red light treatments in office, the convenience of having one at home is fantastic. Red light, along with near-infrared light, works to stimulate collagen production within your skin. I've also had patients over the years who have seen real benefits from at-home microcurrent devices, like the NuFace, which offer modest tightening around the cheeks and jawline. Anytime you can lift and tighten the cheeks, it helps alleviate those folds. Remember, because they're largely caused by the descent of tissue. I always tell people that if you're going to invest in these at-home tools, you need to know thyself, specifically whether you'll actually commit to using them consistently. But 2, you absolutely must keep up with it to maintain those results, as these are not incredibly powerful devices. It's all about small, incremental improvements every single day. For smile lines, I also think gua sha or other forms of facial massage can be quite helpful. Facial massage can aid in redistributing fluid in your face, especially if you tend to be puffy. Constant fluid buildup can actually weigh the face down and start to emphasize those lines. By regularly moving that fluid up and out, you can see some improvement in your smile lines. Now, this won't be a dramatic fix, you won't get rid of an entire fold, but small, consistent improvements are the goal with at-home treatments. Additionally, anytime you massage or lift a line, you're subtly preventing it from creasing further. People are often bothered by 2 things: the fold itself and the small crease etched into the skin. By stretching and moving that skin up and away from the crease, you can help diminish its appearance. Speaking of those creases, another extremely helpful strategy, though only practical for some, is learning to sleep on your back. As a lifelong side sleeper myself, I know this is hard, but if you can train yourself, it truly helps with how your face ages, not just with smile lines, but also with chest and neck creases. If back sleeping isn't possible and these lines really bother you, consider wearing silicone patches along your smile lines while you sleep. These patches act as a support system for your skin, preventing it from folding or creasing in on itself when you lie on your side. You can find face-shaped patches or just use silicone tape from Amazon. Ultimately, I don't want you to obsess over every little thing you can do at home. As I always tell my patients, do your best, but live your life. Constantly trying to smooth out your face or fix every line can lead to a truly miserable existence. Now, let's transition and talk about the in-office treatments that can truly improve these smile lines, as this is often why people seek professional help. I want to immediately address a common question I get almost daily: using Botox in the smile lines. This isn't the patient's fault. It's simply a common misunderstanding. The reason Botox doesn't work for smile lines is because Botox is an injectable designed to relax muscles. When we consider that these lines exist primarily because we smile, injecting Botox to prevent that would effectively stop you from smiling naturally, which would create a very undesirable, almost stroke-like appearance on both sides of your face. So, while the easiest way not to emphasize these lines would be to never smile, that's clearly not a practical solution. Sometimes when people ask about Botox, they're actually thinking about filler, which is an injectable that adds volume and plumps the tissue. However, I want to caution about this as well. Filler absolutely has a place in correcting nasolabial folds or smile lines, but it needs to be done incredibly conservatively and strategically. Remember, the primary cause of these lines is the descent of facial tissue, not a simple lack of volume within the fold itself. When I'm performing any cosmetic correction, it's vital that we only add volume back where it has actually been lost or is genuinely missing. Patients often ask, "Can't you just fill this up with filler?" And yes, technically, with a few syringes of filler, I could make your smile lines disappear completely. But when we step back and look at your entire face, would you actually look better for it? This is a crucial point I discuss with my cosmetic patients. Any intervention, be it Botox, filler, or laser, must be considered in the context of your entire face. We don't treat individual features, we treat faces. If you simply inject filler directly into those lines, you can very quickly start to look puffy, a look some describe as simian or ape-like. No patient comes to my office asking me to make them look like a monkey, and this educational point is something I always emphasize because many hope they can just puff that line out. It's so important that my patients look natural, never done. One of the quickest ways to look unnatural is by aggressively volumizing lines and folds all over your face. These nasolabial folds are often a symptom of a greater issue, the descent of the overall facial tissue. If you don't address that broader problem and just treat the symptom, you won't achieve the results you truly want. That being said, filler certainly has a place directly along those folds, but there's a specific technique I use to ensure a natural appearance. It's not about completely erasing creases or shadows, but rather about subtly lessening how harsh they appear. Over the years, a lot of content on social media has suggested, okay, if not directly in the folds, should you put filler in the cheeks to lift the tissue? This requires an injector with an incredibly discerning eye to determine if you're the right candidate. In my experience, filler doesn't actually lift tissues much, but it can create the illusion of lift if placed properly. This should generally only be done in individuals who naturally have flatter cheeks or less prominent cheekbones. If a patient with already full, beautiful cheeks and high cheekbones asks me to put filler there to lift her lines, doing so would create an alien or feline cheek appearance and likely not help her folds at all. However, if you are someone who has lost volume throughout your face, perhaps from rapid weight loss or simply aging, strategically replacing volume elsewhere in your face can restore balance and make those nasolabial folds or smile lines less obvious and prominent. When I talk about volumizing other parts of the face, I mean areas like the temples, cheeks, or right in front of the ear. There are many places where we can strategically use volume to make those smile lines less noticeable without directly injecting the folds themselves. When I do this, if you step back and look at their face, the smile lines themselves may not be fixed, but because we've rebalanced the rest of their facial features, those lines become less prominent and are no longer a distracting or detracting element on their face. It's absolutely essential to see an injector who is experienced and thoughtful in their approach to volumization to enhance your natural beauty. If you have any questions about filler in general or filler specifically for smile lines, please let me know in the comments below. Aside from traditional hyaluronic acid-based fillers like Restylane or Juvederm, which are used throughout the face and sometimes in the smile lines, I also like to use Sculptra, a biostimulatory filler in this area. Sculptra works by helping to stimulate your skin's natural collagen production. For many patients, particularly younger ones in their 30s or early 40s, who are just starting to see those lines emerge, I often use Sculptra within the fold itself and strategically throughout the face to give their skin a collagen boost. This makes it less prone to falling and sinking over time, which not only helps with existing smile lines, but can also help prevent other lines, creases, and sagging that will inevitably appear with age. Ultimately, while filler is probably the most effective tool in our arsenal for reducing these lines, there are certainly other in-office procedures we can utilize to improve them. Specifically, when it comes to improving skin quality and addressing the early signs of smile lines becoming etched in, resurfacing procedures that help build collagen can be very beneficial. This includes treatments like laser resurfacing and microneedling. Anything that encourages collagen production in the area can help lessen the appearance of those lines, as well as lines across the rest of the face. However, these types of procedures mainly work on the superficial tissues, that top layer of skin, so they aren't effective for addressing deep lines or folds. It's not uncommon for people to ask me about radiofrequency microneedling, mentioning popular devices like Morpheus 8, Profound, or Pensa, and telling me they've heard these can significantly lift and tighten the skin. But not so fast. In my hands, and honestly, in conversations with my dermatology colleagues across the country, most of us haven't seen significant tightening results from radiofrequency microneedling. I have one in my office, and I think it's fantastic for refining pores, helping with acne scarring, and improving overall skin texture, but it will not lift and tighten the skin in any meaningful way. I have simply never seen it do that. These companies do an incredible job marketing radiofrequency microneedling as filling that niche because everyone is desperate for something that effectively lifts and tightens. Unfortunately, it just doesn't deliver significant lift or tightening. I've had so many patients come to my office after spending thousands upon thousands of dollars at other clinics on radiofrequency microneedling, hoping to lift and tighten their jowls, marionette lines, and nasolabial folds, only to see no significant benefit. So while radiofrequency microneedling definitely has a place in skin rejuvenation, it's unlikely to be the treatment that dramatically changes your smile lines or facial folds. On the other hand, I do believe that certain skin tightening devices, such as soft wave ultherapy and thermage, have a small but definite role in improving these lines. I find the best candidates for this type of tissue tightening are individuals who have excessive volume in their face, not those with naturally skinny faces and tiny lines, but rather people with heavier jowls and larger cheeks that are actively weighing down their face and creating those lines. Some of these tightening devices can actually achieve some localized fat reduction if the settings are chosen strategically. I know people often worry about these tightening devices causing atrophy or dying off of facial fat, but when done precisely and strategically in areas where there's excess or irregularly distributed fat, they can genuinely help improve smile lines and jowls. However, by far and away, the single most effective approach to achieve the best improvement for your smile lines is something that actually lifts the tissue. Another common gesture patients make when discussing their smile lines with me is placing their hands at the periphery of their face and pulling back, which makes their smile lines disappear. They then say, "I just want that." Unfortunately, in dermatology, we don't have many non-surgical options that can provide that level of significant lifting and tightening, often multiple millimeters or even over a centimeter of lift. Threads are sometimes marketed as having the ability to lift tissue, and you do see an initial lift. However, in my experience and from observing many patients who receive threads over the years, the lift tends to be very temporary. Patients often end up disappointed because their skin eventually and inevitably sags back down quite quickly. This might be acceptable if threads only cost a few $100s and weren't particularly invasive, but getting threads is actually a significant procedure, often quite expensive, and for many, the results just don't feel worth the investment. Ultimately, the most effective way to truly get rid of deeply etched smile lines is through a surgical facelift. I know this isn't what many people want to hear, especially when they come to a dermatologist's channel hoping for non-invasive solutions, and I have certainly provided those. But the reality is, because smile lines are so significantly driven by the descent of tissue, eventually, the only way to genuinely fix them is to surgically lift the tissue back to where it started. If there were amazing non-surgical alternatives that achieved exactly what a facelift does, improving the skin and the overall shape of the face, then facelifts wouldn't even exist anymore. But there is nothing that truly rivals the comprehensive results of a facelift. So, if your smile lines genuinely bug you, and especially if you're also noticing other lines around your face, jowling, or sagging in your neck, then surgical intervention will deliver the most profound and lasting improvement. While a facelift doesn't last forever, among all the interventions I've discussed, it certainly offers the longest lasting effect because it directly addresses the displaced volume and repositioning it where it belongs. Many patients tell me, "Look, Dr. Ellis, I'm never getting a facelift," and that's perfectly fine. Getting a facelift isn't a universal solution. or something everyone can afford or wants to take on the associated risks. And as I've explained, there are many other excellent things we can do to improve these lines, but it's important to understand that nothing will yield the exact same dramatic and long-term result as a surgical facelift. I truly hope this video has provided you with helpful guidance and understanding when it comes to managing smile lines. If you found it informative, please give it a thumbs up and make sure to subscribe to the channel so you don't miss out on future insights. I'm incredibly curious to hear if any of you have tried different approaches to help with your smile lines and what has worked for you. So please share your experiences in the comments below. I'll catch you next time, and thank you so much for being here.